If you've ever had a kidney stone, you know how painful and miserable these stones can make you. Well, I'm going to help put you in control. I'm going to talk about some dietary and over-the-counter supplements that you can use to help prevent these darn stones from coming back. Check us out. Hey guys, it's Doc Hepps here with UroCoach. So if you formed a kidney stone, did you know that there's up to a 50% chance you're going to form another one in the future? So you want to do everything you can to help prevent these miserable and painful stones from recurring. We're going to talk about some dietary, actionable ways to adjust and decrease your risk of forming these stones. We're also going to talk about some supplements you can get over the counter that have been shown to decrease your future stone risk. Make sure you subscribe, like, comment, and stay tuned to the end. I'm going to give you some super cheap way to prevent stones from forming. I'm going to go over 4 actionable things that you can change to decrease your risk of forming stones in the future. Number 1, fluids. Number 2, a healthy diet. Number 3, increasing the citrate in your diet. And number 4, monitoring your calcium and oxalate levels. So how is this done? Let's get started. Number 1, you need to increase the amount of fluids you take in each day. Your goal should be about 3 liters of fluid intake per day. What kind of fluid? It doesn't really matter. You can drink water, coffee, beer. You just want to avoid sugary drinks like sugary colas, sugary punch, sugary teas. So it doesn't matter really what you drink as long as you get your fluid volume up. You want to make 2.5 liters of urine a day. Those folks that make more than 2.5 liters significantly reduce the amount of stones they form in the future. Number 2, a healthy diet. Something called a DASH diet, a dietary approach to stopping hypertension with lots of vegetables, lots of fruits, relatively low animal protein. That's been shown to decrease your stone risk. We'll put that type of diet in our show notes. Number 3, increase the citrate in your diet. Citrate can come from lemon juice lemonade, but you really need to drink half a cup of concentrated lemon juice per day to increase the citrate. And that's just not practical for a lot of people. So what I've recommended to my patients is something called LithoLyte. It's an over-the-counter supplement, kind of like a Crystal Light. You tear the packet open, put it in a half a liter of water, you take it down. It's easy, it's affordable. It's a very efficient way of getting in that citrate. Citrate is a stone preventer. It binds calcium. It also increases the pH and alkalinizes the urine, thereby preventing stones. Lastly, calcium and oxalate. Most stones are made of calcium and oxalate, and that crystallizes and forms 80% of stones. So some people think if I decrease my calcium, my stone risk goes down. Not true. You want a moderate amount of calcium in your diet, about 3 to 4 servings of dairy per day. Too much is not good, too little is not good. Now, oxalate is in a lot of healthy foods, including spinach, leafy greens, berries, and nuts. There are a few foods that are very high in oxalate. I'll put those in our show notes. These include spinach, rhubarb, beets, almonds, as well as vitamin C, which in excessive amounts gets metabolized to oxalate. You want to minimize those, but in general, you want to eat a healthy diet and don't worry so much about the oxalate levels. Just avoid that super high oxalate foods and you'll be fine. If you're super worried about high oxalate and you're a huge spinach eater, there are certain supplements also by the LithoLyte company that you can take with meals that will help reduce the absorbed amount of oxalate and help ensure that you prevent your overall stone risk. So what's the bottom line? Increase your fluids. Take in at least 3 liters a day. Try and make 2.5 liters of urine daily. Avoid sugary drinks. Eat a healthy diet. Increase the citrate in your diet, a moderate calcium, and avoid very high oxalate foods, and you're going to certainly reduce your stone risk. So remember I told you about that super cheap thing that can help prevent stones? Well, it's as simple as baking soda. Quarter teaspoon twice a day of sodium bicarbonate or baking soda, a super cheap way of reducing your risk of forming kidney stones. What it does is it alkalinizes or increases the pH of your urine, thereby reducing your risk of stones. So make sure you subscribe, like, comment. We love hearing from you. Check out our show notes. Thanks for watching.